Ladies and gentlemen, can I have your attention? My name is Lee Milligan. I'm the CEO of MQ Mental Health Research. Let me start this afternoon by asking you a few questions. Why can't I sleep at night? How do I help my child through a pandemic? How do I stop a loved one trying to take their life again? All these questions have one thing in common. They're far too important for us to take a guess at the answer. And for too long, long before there was a COVID-19 pandemic, we were in a state of pandemic already, with rising needs in mental health services, increases in pressure and stress resulting in more diagnosis in children and young people and in adults in mental health conditions across the country and around the world. Depression is on track to be the biggest global burden of disease by 2030. And yet, investment into research has stayed flat in the UK and globally for a decade. It's too important for us to keep taking a guess at the answers. And without research, it's just guesswork. I'm really honored today to be hosting the awards for NIHR, the National Institute for Health and Care Research, supported by the McPin Foundation and MQ Mental Health Research, to honor and to recognize research projects that have invested in answering these questions, and specifically to projects that have ensured that patients, carers, people with lived experience of mental health are at the very core of the design, communication, and implementation of those research projects. If we cast our minds back just a decade ago, far too much research in mental health was done in silos, done in academic institutions without the engagement of the very people that research was meant to serve. We've come a long way in the last 10 years, but we've got a lot more still to do. And award ceremonies like this that highlight the best practices and the ability to engage people in research and use their skills are hugely important in continuing to make those developmental steps to improve the outcomes of research for the people it is meant to serve. Engaging people with lived experience moves research away from the quest of interest to the design of impact. And that's what it's all about. Collaboration in research is something that MQ, McPin, and NIHR have long pushed for. And I'm really excited today that we've got awardees whose collaborations go far and wide. In terms of these award ceremonies, this is the fourth time that these three organizations have partnered together to honor and recognize awardees. And outside of that, these three organizations work together on a range of projects. NIHR and MQ have worked together on the FOSP COVID study, which along with universities of Leicester, King's and Oxford have gone on to understand the impact of long COVID, both on physical and mental health, and spurred new and additional investment into understanding the implications of brain fog. That project was centered around patients of long COVID, designing and understanding the questions that they wanted to see answered so that the researchers and the research that came out of it was directed to interventions and services. MQ and McPin worked together with young people across the UK to design a prioritised understanding of what they felt was most important in children and young people's mental health. That report, published in 2018, has gone on to direct and to guide other funders, the government, the all-party parliamentary group report in 2021, which led to new investment in mental health services in schools, and a recent report by the Royal Foundation on the impact of a lack of diversity in research on children and young people. It's only through collaborations between organizations rather than competition that we will see mental health transformed and the landscape changed. I'm really excited to have two fantastic projects here today, and we'll be hearing from both of them to understand exactly what their work is doing and how they've engaged people to make sure that their impact is most clear. I'm going to start by introducing our first presenter, who will be introducing the Runners Up Award for today. So please put your hands together for Inti Qureshi from NIHR.
Hello, thank you. Yes, I'm delighted to be here, Lee. Entirely endorse what you've said. In fact, I'm going to be returning to some of those themes in my presentation. So, first of all, delighted to be invited as a judge for these awards. I'm here on behalf of the NIHR Mental Health Specialty Group. So, before I invite Heidi to tell us a bit more about the Runners Up project, which was successfully awarded, let me tell you briefly about the NIHR Mental Health Specialty Group. So it was set up in 2006. I think there are about 30 specialties across the NIHR network, of which mental health research is one. Mental health research is incredibly important. We've heard about the research gap. I'm a full-time consultant in the NHS as well as being a clinical academic, and it's only by collaboration and working with our PPI partners that we can address the very important research questions that are out there. NIHL works with clinical academics, industry partners, universities, and our PPI groups. And why is that important, you might ask? Well, I can only reflect on my own experience as a chief investigator for trials both here and abroad, that recruitment to mental health studies remains very challenging. About 50% of trials fail to recruit to their successful numbers. And that's a waste of resource, it's a waste of public funding. A lot of effort goes into designing trials, and failure to involve participants to enter the trials and, more importantly, stay in our studies is extremely challenging. Over the last 10 years, we've moved away from a traditional paternalistic model of clinical academics setting the research question, what we think is important, to reaching out and collaborating with our PPI partners to say, well, what are the questions that you want to address? What are the research questions that are important to you? How can we design trials that mean that you're going to join the studies and generate data which are going to improve public health outcomes? I think there's some way to go. We've come on in leaps and bounds in the last 10 years. I've recently been awarded a large grant from NIHR, and the reason it was funded was because right at the very outset, we did about a year's preliminary work engaging with service users to say, look, is this question right? Is it relevant? Do you think it's important? This is our study design. Do you like it? What do you think could be improved? So when I started 25 years ago in mental health, it was a very paternalistic approach. We worked on patients. In fact, some of the terminology that we used back then would be shocking if I was to, share some of those with you today. In fact, I'm doing a presentation next week on the Mental Health Act. The Mental Health Act from 1959 uses words like idiot and lunacy, and the 1983 Mental Health Act is going to be substantially revised. It's on the government's legislative program, and I hope that we're going to use what we've learned in the last 20 years to continue to improve patient and public health. So I was delighted to be invited to judge really good applications to these awards, and I'm going to invite Heidi to talk a bit more about the EN-CAMHS study, which was the runners up. I was looking at the judges' comments last night and having a look, and I think the EN-CAMHS study stood out for a number of reasons. One is because they recognize the public concern about growing child and adolescent services, waiting lists in particular. At the study outset, they reached out not only to patients and carers, they reached out to a very large third sector organization providing support services for children with mental health services. I think what was particularly impressive was study dissemination. It's a frequent criticism of study teams that once the study's ended, research isn't shared with our public patient partners. We tend to present findings in academic journals and conferences. That's simply not good enough. Our PPI partners invest a lot of time and effort. We need to go the extra step as working with our partners to go out into non-traditional forums and share the research ideas. And only by doing so will we then generate an appetite for future participants to join future mental health research studies. So the EN-CAMHS study, I think, stood out particularly because of its innovative media techniques to use their study findings. I think using podcasts, I thought was particularly neat. It's something that I'm going to start doing as well now. That's one of the neat things about being a judge on awards. You can take, ideas, adopt them. It's not misappropriation, it's adoption. And so without further ado, I'm going to invite Heidi to tell us more about the EN-CAMHS project.
So the GM Digital Research Unit is based at the Greater Manchester Mental Health NHS Foundation Trust, and we're currently conducting the Enhancing CAMHS Referrals Project, also known as EN-CAMHS. And just for reference, CAMHS stands for Child and Adolescent Mental Health Services. The EN-CAMHS project is responding to an urgent need to improve the CAMHS referral process so that only children and young people who need to access the service are referred. A report published between 2018 and 2019 by the Education Policy Institute highlighted that 25% of children and young people referred into the service were not accepted for treatment. Therefore, the project aims to understand what the difficulties are in making these referrals into CAMHS, but also to think about potential solutions to these problems and improve the referral process so that only children and young people who need to access the service are referred. The data within the project consists of a data set of referral data obtained from 4 trusts in the north of England and their individual CAMHS sites. But we've also extensively engaged with over 100 key CAMHS stakeholders from across the country through a series of focus groups to again think about the problems in the CAMHS referral process, but to also think about the solutions. The CAMHS stakeholders we've engaged with include children and young people and parents and carers who have experience of the referral process, key referrers into CAMHS and CAMHS professionals themselves. We co-designed EN-CAMHS with a diverse group of over 50 children and young people and parents and carers from across the country through the GM Digital Research Unit's Young People's Advisory Group known as CAMHS Digital, a long-standing children and young people's mental health champion, and Place and Calm Connections, who were key collaborators on the project, and they provided the insight and perspective of parents and carers. Place is one of the largest UK support networks for parents and carers, and Calm Connections is a local support network for parents and carers based in Manchester for the surrounding areas. We also have 2 advisory groups on the project. We've got our Young People's Advisory Group, known as our YPAG, and our Parents and Professionals Advisory Group, known as our PPAG. These groups have acted as independent advisors throughout the project and have monitored it against the objective, which we mentioned at the start. They've been involved in all stages, from setup to recruitment. They're currently involved in the analysis phase, and as mentioned before, will be involved in the dissemination strategy, which will take place at the end of the year. Our advisory groups have made key contributions to the project in the form of timely adaptations to focus group research questions to ensure that these were understood by our participants and presented in an order which made sense. They've helped the project team enhance our recruitment strategy to overcome recruitment barriers. So, for example, our YPAG highlighted that sharing recruitment advertisements on platforms such as Instagram and approaching 6 forms would help us meet our recruitment target of children and young people, and they were right. And our Parents and Professionals Advisory Group helped us recruit our target number of CAMHS professionals because they were a group that we did have difficulty recruiting. And when we asked for suggestions from our PPAG, they recommended attending specific meetings within local CAMHS services and also altering the times of the focus groups to better accommodate people's availability. And again, they were right, and we met our recruitment target. At the moment, our advisory groups are involved in the analysis stage of the project. And just last week, we had a discussion with our PPAG about how data variables are defined and what that means to the service users and parents and carers. So as we've said before, it's not just our research team understanding and our perspective, it's really hearing that insight of those individuals. By having our advisory groups and the element of co-design when we were setting up the EN-CAMHS project, we've heard first-hand experience of what the problems, pain points and challenges are within the CAMHS referral process. But these same individuals have also been involved in the discussions around the solutions to these. Therefore, the findings from EN-CAMHS will wholeheartedly reflect the needs of service users, parents and carers who are involved in the CAMHS referral process. Thank you very much.
Well done, Heidi. Really good work. Well done. Congratulations.
Thank you so much, Heidi, and congratulations to the EN-CAMHS project. I now would like to introduce our next presenter to hand out the Winners Award. So please put your hands together for Thomas Kabir from the McPin Foundation. Thomas.
Thank you very much for that introduction. So, I mean, congratulations both to NEON and to the EN-CAMHS study team. And indeed to everyone who applied for the awards this year. We saw some stunning involvement. And it's particularly difficult during the pandemic, as it's been difficult for so many people, in transitioning from doing things in person to doing things virtually. And I think we saw some stunning examples of how people have handled that. I would just like to say a bit about McPin and the awards. The McPin Foundation is a charity that really aims to put people with lived experience at the very heart of research. We're extremely active and we work with people across the country and indeed internationally now. We specialize in involving people with lived experience, both in conducting research and actually being involved in research. And like MQ, we have supported many COVID-related studies, including FOSP. The McPin Foundation has funded service users to act as judges for each of the awards since 2016. And I've been personally involved in the award since 2009 when I used to work for the Clinical Research Network. I hope perhaps that in time, other organizations such as the Wellcome Trust and the Medical Research Council might join us for next year's award. But I would just like to read out a quote, if that's okay, from one of the service user judges for this year's award, because I think it just puts things really, really nicely and better than I ever could. I was delighted to be invited to judge the Involvement Awards this year. I have lived experience in being involved in mental health research as a participant, as a lived experience advisory panel member, and as a lived experience researcher myself. Each of these experiences has shaped my perspectives on what matters in good quality research, particularly in involving people who are directly impacted by the research itself. Awards that recognize and celebrate high quality involvement matter greatly. They raise the profile of the necessity and importance of lived experience involvement in research and spotlight excellence in practice. Hopefully, they also raise standards year after year by pushing researchers to consider issues of current relevance and apply creativity and innovation. Most of all, I hope that they recognize the many hours of dedication and passion that people with lived experience commit to the projects that they get involved with, often motivated by a desire to improve the outcomes for people living with a mental health condition. I just think that puts it so well. But the most important thing for me to say is to congratulate everyone involved in the awards and today for this year's winner, the NEON study. The NEON study is all about harnessing the power of the stories of people with a mental health issue. The study aims to see if a library of these narratives can help people who experience a mental health issue. Another aim is to see if these narratives can assist staff to work better with service users. The study quite literally puts the voice of people with lived experience at the very heart of research. All of us congratulate the people of the NEON study for winning this year's awards. Thank you. So I think we agreed with the team this year that I would give the award. So can I invite the NEON study team to come and then they'll say a little bit about the study itself to receive the award. So on behalf of all of us, can I present you with this year's award? Thank you very much.
Yeah, so thank you everyone. So I thought I'd just talk a bit about the various ways in which people with experience of mental health problems have been involved in our study. So as was said in the introduction, we're looking at how people's accounts of recovery from mental health problems can be used to help other people. And certainly our study takes place in a time period where people are being more open about mental health in some ways, but I think there are lots of mental health experiences which perhaps aren't discussed so openly at present. So if we take experiences of psychosis, for an example, it's quite rare, even nowadays, to hear a public figure who will talk about personal experience of psychosis, but there are many public figures who will talk about personal experience of anxiety or depression. And I imagine that's still because these experiences are still quite stigmatized. But because of the online world, there are many thousands of stories of experiences of psychosis and of recovery available to the public. And in our study, we hope that bringing together some of this material, and we're not just focused on psychosis, but that's an example, will provide a way of helping other people. And even though these stories are readily available, they describe deeply personal, often very difficult experiences that are still subject to stigma. So to work with that material in honourable ways that do justice to it, we've absolutely needed people with experience of mental health problems to be involved from the start of the study to the end. And the study is still rolling on and people are still involved. We have a formal lived experience advisory panel who was formed before any of the researchers were employed on the study. And lived experience advisory panel members have attended every single interview session for a study team member. So I was asked questions by people on our panel. And the study team quite deliberately incorporates people with personal experience of mental health problems, either in self or in others. And every job advert has at least placed that as a desirable criteria. And of course, there's different types of personal experience. So people might bring personal experience of mental health problems, but also of publicly sharing a narrative, because it's a very different thing to experience something yourself, as opposed to make the choice to place that narrative out into the world, with often benefits for someone, but maybe some negative consequences as well. So we have people in the team and in our lived experience advisory panel who've made that step and who can talk to us about what it felt like and what it meant to them. And then we've involved people with lived experience in many of our study processes. So through formal panel meetings, but early in the study, we conducted a systematic review on how narratives can help people. We only found 5 papers at the time, which wasn't enough knowledge really to underpin the development of our intervention. So we managed to publish a hybrid paper where we presented knowledge that came from research papers, but knowledge that came from our lived experience advisory panel, or LEAP. And to their credit, that was published by the Canadian Journal of Psychiatry, who were willing to accept a paper with a hybrid method. So we hope that that's one small innovation that might play out in future systematic reviews. But we've involved people with these experiences directly in the most difficult ethical decisions around our study. And those ethical decisions have involved how to work with narratives in an ethical, legal, and respectful way. So these decisions have been discussed at research team meetings where people bring their own lived experiences. They've been discussed at many panel meetings of the full lived experience advisory panel. But we've also formed a separate collection steering group with 4 LEAP members and 2 researchers who co-produce decisions around which narratives can be included in the large collection that we've assembled and which can't, but also how the criteria that we use evolve and develop. And I think we've had 8 meetings of that panel, and every meeting has discussed difficult choices, such as particular narratives that maybe include graphic descriptions of self-harm and of recovery, and the right balance between including material that shows people what's possible, but also making sure that there's no harm caused to recipients by engaging with material that's just a bit too graphic. So it's an ongoing process. We've been working on it for 5 years, and of course, Mike Slade, as CI, worked on it for many years before that in terms of securing funding. And we're now heading into the final stages of our project as we wait for the results of our trials, and where we're starting to think about what comes next in terms of grant applications. So enormous project, enormous study, and lots of people to say thank you to. So we wanted to very explicitly say thank you to our funder, the National Institute for Health and Care Research. We wanted to say thank you to McPin, who've been deeply involved in our programme throughout, before the study started and all the way through those 5 years. We're hosted at 2 organisations, so the School of Health Sciences at the University of Nottingham, who provide an academic and a research base for us, and many of us are based in the Institute for Mental Health, which provides a very productive mental health environment for us to work in. We've been supported by more than 800 community organisations in terms of recruiting to our trials, and of course, you know, many of those organisations will remain nameless, but we've engaged with organisations, and those organisations have helped us to find people who might want to take part in our trials of our online intervention. So successful recruitment to those trials couldn't have taken place without those organisations. Yeah, and thank you very much to the people who've organised this award, and hopefully it will continue to encourage healthy involvement in research in the future. So we're very proud to be here. So thank you very much.
Brilliant, thank you so much, and a huge congratulations to the NEOM project as winners and to the NIHR project as runners-up of this year's awards. 2 very different pieces of research, but united by the fact that at their very core, their planning, their design, their ongoing management, and the dissemination of the findings are all being led by people with lived experience or carers of those with mental health diagnosis. A huge congratulations to both, and we're really excited in the next sort of 12 to 18 months to see what the outcomes of both projects are. A few thank yous from me. A big thank you to my co-host today, to Inti and to Thomas, for your fantastic presenting. A big thank you to Deutsche Bank, which is hosting us today. Deutsche Bank chose MQ Mental Health Research as its charity of the year for this year and next year. I think it's a huge statement that an organisation the size of Deutsche Bank has put mental health at the very forefront of its charity of the year and embedded it into its own organisation. So a big thank you to Deutsche Bank. They've also provided all the live streaming services that we've got for those of you that are watching online. And as we've said, part of this awards is to continue to challenge others, to put those with lived experience at the heart of their research, and to elevate projects of great success. And so we'll be using the recording of this to push out information on both these projects and the need for more lived experience in research. So do take a look out on social media for the clippings and recordings of this, and do share it with everyone you know. As we said, great progress has been made since the Mental Health Act of 1983, but there's an awful long way to go to continue to push forward. Thank you for leading the way, EN-CAMHS and NEOM. That brings our awards ceremony to a close. Thank you so much to the National Institute for Health and Care Research for hosting these awards again. Thank you to our co-sponsors, McPin Foundation and MQ Mental Health Research. It's been a real honour. For those in the room, there'll be lunch served in a few minutes next door, and we can chat a little bit more about the projects. Thank you all very much for attending today.